For me, patient care is the most important part of my job, and Cleveland Clinic actually, they just don't just talk about patient first. They really live that every day. So when I came here, I really found that this is a patient-centered environment, and that's what I want to do, and that's what I want to do every day. It's a very unique field because we are dealing with probably one of the toughest diagnoses around. And once a person gets a diagnosis of cancer, it changes their life. So when you're asked to see or take care of such a intense diagnosis, I think it really takes a special person to do that. So when I see a patient, I really want to know them as a person. So I make an effort to make that happen, not just a stage 2 breast cancer. And I want to know what they do, and I want to know what drives them, what are their hopes and dreams. So knowing them as a person, a mother of 2, a teacher who is trying to balance their full-time job and the kids and taking care of the older parents, that actually really gives me a full picture of who they are. I think that's an extremely important component of the treatment planning. That will help us to develop the treatment plan specifically for them, understanding their fears and hopes. If a patient is eligible, clinical trial is the gold standard of cancer treatment. And we strongly encourage the patients to consider clinical trial if they are eligible. So clinical trial or clinical research is never a last treatment option. Many people think that clinical trial is a last treatment option. Absolutely not. We have clinical trial option for a stage 1, or stage 2, or stage 3, or stage 4, any stage of patients. So considering a clinical trial is an extremely valuable tool in fighting cancer.